care about whether the hospital was wrong nearly so much as they care about whether or not you're going to put your child in danger. Because the judge's only concern is, if I send this kid back to mom and dad, are they going to kill her?
The Netflix documentary Take Care of Maya has really had a lot of people asking a lot of questions. It's also pissed a lot of people off, and it really is a sad and tragic story.
But there's nothing that could prepare me for what I went through with my family. Nothing.
Maya Kowalski was 9 years old when she began experiencing asthma attacks and headaches, and soon after lesions began forming on her legs and arms, and her feet began cramping and curling. And after many doctors failed to identify Maya's symptoms, one doctor suggested that it could all be in her head. However, Maya's dad, a former deputy fire chief, Jack Kowalski, stated that she would be crying 24/7 and that he knew she wasn't faking it. After online research, Maya's mother, Beata, who was trained as a registered nurse, was informed that Maya could be experiencing complex regional pain syndrome, a neurological condition that can cause constant or intermittent pain. Maya's family then sought out Dr. Anthony Kirkpatrick, an anesthesiologist who specializes in CRPS.
One of our primary missions is to provide current research that's ongoing with regards to complex regional pain syndrome.
Dr. Kirkpatrick then subsequently diagnosed Maya with having CRPS and treated her symptoms with infusions of ketamine. Maya's symptoms seem to have improved with the ketamine treatments until October of 2016, when she was rushed to Johns Hopkins All Children's Hospital emergency room in St. Petersburg, Florida. Hospital officials grew suspicious after Maya's mother asked doctors to prescribe her daughter a high dose of ketamine, the one treatment they were prescribed to help alleviate their daughter's pain, and the only treatment that seemed to help. And it was around this time that Dr. Sally Smith, the old battle axe pictured here behind me, was contacted for the first time, and the Kowalskis' lives would be changed forever. Smith, who was the medical director of the child protection team for Pinellas County, listened as the doctor detailed the case. Now, it should also be noted that Dr. Sally Smith has over 30 years of experience in child abuse pediatrics, and virtually every single medical provider in Pinellas County regarded her as the Michael Jordan in her field. A pediatric ICU physician told Smith several disheartening things about Beata Kowalski, as she described Kowalski as pushy and said that she had asked for her daughter to be given 1,500 milligrams of ketamine, which seemed like a huge dose. The pediatric physician also went on to say that Maya seemed to shake and cry out a lot less when Maya's mother was not in the room. Smith was particularly concerned to learn that Maya was already receiving regular ketamine infusions and agreed that it seemed unorthodox as a way of treating CRPS in a child. Smith then proceeded to log on to an internal all children's portal where she began to read through Maya's medical records. And it was here that she discovered that Maya's parents had once taken her to a hospital in Monterrey, Mexico for a 5-day procedure that required her to be sedated and intubated to receive high-dose infusions of ketamine. Smith also stated that the medical records showed that Maya had seen at least 30 different medical providers, and that to her it seemed like her parents were doctor shopping, which is basically the practice of visiting multiple physicians to obtain multiple prescriptions. And it's pretty common with people who have substance abuse issues or people that have a factitious disorder. And it was around this stage that Smith began to develop a theory that Maya was a victim of Munchausen Syndrome by proxy, which is a condition where a parent will deliberately make a child ill in order to reap some sort of sympathy or gratitude. As Smith continued her investigation, Beata and Jack Kowalski grew restless, and on Monday, October 10th, 2 days after Smith had been called, they told an attending physician that they wanted Maya discharged. However, they were told by the hospital that this would be against medical advice and that they would like to complete their evaluation of Maya, and that if they attempted to take Maya home, that they would be arrested. Dr. Sally Smith also had the power to recommend that the state separate abusive parents from their children. Now, this is a pretty massive decision to make, because if you make the wrong call, you'll be breaking up a family unnecessarily. But if you ignore a warning sign, a child could end up dead. And early on Thursday, October 13th, 2016, Smith filed a report chronicling Maya's extensive medical history, and her formal diagnosis was Munchausen Syndrome by proxy. And the state quickly issued what is known as a shelter order, where Maya was directed to be kept in the hospital and also forbidding her parents to be able to see her. Now, CRPS, the condition or the disorder that Maya was diagnosed with, is said to be a very poorly misunderstood disorder, which typically begins after an injury or impact to a limb, causing chronic pain, sensitivity, stiffness, and muscle atrophy that can last for years. Interestingly enough, CRPS also ranks number 1 on the McGill Pain Index, which is an accepted measure of physical suffering, and it's also known as the suicide disease because of its lack of viable treatments. Now, where things get interesting is that it should be remembered that it was Dr. Anthony Kirkpatrick that diagnosed Maya with having CRPS and not her parents. And he was the one that told her parents about the novel treatment of ketamine infusions that could alleviate some of her pain. And Dr. Kirkpatrick also reminded Dr. Sally Smith that he had been the one to first diagnose Maya, and that he also recommended the procedure in Mexico. Furthermore, Dr. Kirkpatrick also stated that he cautioned Dr. Smith about accusing a family member of criminal conduct as she moved forward with her investigation, noting that doing so could result in needless and permanent harm to the child and the family. Now, it should also be noted that the Kowalskis took Maya for these ketamine infusions once every 3 to 4 weeks, and Dr. Kirkpatrick charged $10,000 per 4-day session, which was not covered by medical insurance. The Kowalskis eventually sold a rental property to cover the cost, and eventually they shifted Maya's treatment to a second specialist, Dr. Ashraf Hanna of the Florida Spine Institute, whose rates were much lower. And Dr. Ashraf Hanna also advised Dr. Sally Smith that Munchausen by proxy is a common misdiagnosis for CRPS. And shockingly enough, both of these warnings from both of these doctors, who are not only doctors, they're specialists, were ignored and not put into Sally Smith's report to the state, which urged that Maya be protected from her parents.
Beata, this is the thing you need to understand about these cases. They're not fair. They don't care about evidence. I've done 60 of these cases from the parent perspective, and cooperating is the best way to get your kid back.
Okay, but I'm gonna stop you here for a second. They told me every day that they have no idea how to treat this condition, and I want my daughter to be treated.
Now, I'm sure all of that is true, but once the case has already started, none of that really matters anymore.
One method of supporting a Munchausen by proxy diagnosis is to perform a separation test, whereby the child is separated from the offending parent, and then to see if the child's health dramatically improves. But as weeks went by, with Maya still being isolated, she continued to report extreme pain. Dr. Sally Smith, who still wasn't buying the whole CRPS diagnosis, was starting to worry whether or not something else besides Munchausen by proxy was happening. Smith then proceeded to instruct doctors to secretly videotape Maya and asked nurses to try to catch the girl moving her legs, thereby amazingly and shockingly implying that Maya was faking it all along. And after monitoring Maya, a hospital employee sent Smith the following text message. I just went to see Maya. I watched her use her feet to push herself several feet in her wheelchair. She was distracted, and I'm not even sure she realized she did it because I didn't call attention to it. To which Smith replied, fortunately, at 10 years old, she can't perform the charade effectively 24/7, and she doesn't even know if she's making physiological mistakes. I'm coming to take some pictures of her affected legs. And by December, a hospital pediatrician had changed Maya's diagnosis from Munchausen by proxy to a factitious disorder. And this basically meant that Smith and the doctors no longer suspected that her parents were causing her illness. And it was basically an accusation that Maya was making everything up. Even when all children accepted Smith's finding that Maya was faking her condition, going so far as to say that the strange bumps and lesions that continued to appear on her arms, legs, and forehead were self-inflicted, it did not alter her custody status and she remained separated from her parents. Pretty messed up, right? But wait, it gets worse, because it proved to be very lucrative for the hospital to keep Maya separated from her parents. In the months that Maya was forced to remain there, All Children's billed her insurer more than $650,000 for her treatments, including 174 entries for CRPS, the disease that Maya now supposedly didn't have. The state shelter order was eventually revised to allow Jack some visitation rights and also to permit Beata to contact Maya by phone and video. But by December, hospital staff were imposing additional restrictions at their own discretion, as Maya's social worker, a lady by the name of Cathi Bedy, declined several of Beata's FaceTime calls, which went from daily to once a week. It was of course later disclosed that Bedy was fired from a previous position where she managed foster care children when she was arrested and charged for child abuse. During one of Maya's many court hearings, Maya waited in a holding room while the family attorney told the judge that Maya had two requests: to speak to him and to hug her mother.
That's why the best way to get this case to end successfully, in my experience, is to convince everybody that you have changed your mind and that you are going to do what they tell you to do.
Mm-hmm.
And then when you get your child back, you leave that hospital and you never ever go back.
The judge denied both, and in the days that followed, Maya's mother, Beata, committed suicide. Maya's mother left a note which stated the following: "I'm sorry, but I no longer can take the pain being away from Maya and being treated like a criminal. I cannot watch my daughter suffer in pain and keep getting worse while my hands are tied by the state of Florida and the judge." Now, this is such a shocking, tragic, and heartbreaking story. And to make matters even worse, Dr. Sally Smith has previously stated that the reason I end up determining that children have been abused when others aren't sure about it is because I just keep asking more and more and more questions. Now, I found this very interesting personally, because what she's basically saying is that she'll ask more and more and more questions until she finds an answer that kind of fits her predetermined narrative that a parent is guilty. Now, I'm sure that she didn't start her career with the intentions of breaking up families and sending innocent parents to jail. But, you know, one has to wonder whether or not the power and, I guess, respect that she gained in the medical community for saving children, and no doubt she did. There obviously are children that she saved from being abused and from abusive homes, but you kind of get the feeling that she started seeing every single child that came across her as a potential abuse case. And it's a strange one. It almost seems like she has a type of Munchausen syndrome where she has to save a child in order to continue getting the recognition that she has in the past. There are at least 12 documented cases in which Smith identified abuse only for the children to be returned to their parents, charges dropped, or the DCF to reverse its separation order. However, in recent interviews, she has stated that she's unaware of any cases in which she's ever made an incorrect conclusion. Now, after watching the Netflix documentary, as well as reading up and doing a bit more due diligence on the case, because there is some information here and there that was left out of the documentary, it does, however, become obvious that the Kowalski family was definitely not the only family whose lives were shattered because of child abuse allegations made by Dr. Sally Smith.
The nurse walks back in that was helping me. She told me I had to leave, that my daughter is under state custody. I remember looking in my daughter's eyes and she's looking at me. I'm wondering if I would ever see her again.